One of the most influential voices in the effort to end HIV transmission in the UK is the National AIDS Trust. The Trust works with the government, healthcare providers, other sector organisations and people living with or affected by HIV. It pushes for better access to effective treatment and to tackle stigma and discrimination, amongst many other issues. We sat down to talk with NAT's Chief Executive, Robbie Curry.
Robbie Curry, CEO of the National AIDS Trust, welcome. The National AIDS Trust works to stop HIV from standing in the way of health, dignity and equality. What victories has your work achieved in the past, and what are your main campaigns going forward?
I suppose a recent kind of victory for us, and one that I know that NAT is very proud of, really. It's a bit challenging in some ways because we took NHS England to court to ensure that an HIV prevention medication called PrEP was available to everybody who needed it. We've also achieved, equality really for LGBT people seeking IVF kind of treatment. So that has enabled a whole range of LGBT people to start families. And we're really very pleased about that one because it very clearly just sort of eliminates an area of kind of discrimination. I suppose some of our campaigns and some of the things we're working on for the future. HIV Confident is a charter mark which we're asking organisations to sign up to. And that really is making sure that people living with HIV will be confident in going to that organisation, that they will be treated fairly and with dignity and kind of respect.
Yours it's a hands-on involvement, working with partners, policymakers and people living with HIV. Can you talk about the importance of including diverse voices?
Sure, of course. HIV has always disproportionately affected certain kind of communities. And it's imperative that we make sure that no one's left behind or any voices are not heard or captured. So we work with the One Voice Network, which is a collective of Black-led community organisations. And we work very, very closely with them to make sure that we capture their experiences of HIV treatment and care. But we also work with a range of other kind of partners. We're very lucky that we work with the all-party parliamentary group on HIV and sexual health, for example. But we also very clearly work with partner organisations such as BASH and Beaver, clinical groups. And I think it's important to say, actually, they were instrumental in working on the fertility work that I'd mentioned before. But yes, it's very important to us that we make sure that we capture a range of diverse voices.
Discrimination is sadly still very common. What are the kinds of discrimination that your discrimination advice service sees? And what are the harms that HIV stigma and discrimination cause?
Our discrimination service is a helpline. We get referrals from many organisations, not just in England, but across the UK. And they report, very sadly, sort of a range of incidences, potentially in the workplace or in housing or in healthcare. It's 2024. Discrimination, sadly, still really exists for people living with HIV. And it's imperative that we challenge that. Not only does discrimination lead to worse health outcomes overall, but it can prevent people from coming forward for treatment or coming forward for testing or being able to take up prevention interventions. So it is absolutely imperative to us that we seek to challenge that. And the service, as I say, does help with that.
Why is World AIDS Day important to the National AIDS Trust?
World AIDS Day is not just important to the National AIDS Trust, it's actually important to the sector as a whole. It provides a focal point for us all to, one, remember very, very sadly all the lives that we lost since the emergence of HIV, but it also enables us to demonstrate and show solidarity. I mean, I'm wearing my red ribbon here, and so even when I'm out and about and travelling around public kind of transport and everything, I see people very, very clearly looking at this. And there is a number of people that I see that recognise that and kind of, acknowledge that. And so it's imperative that we, as a society, show solidarity with people living with HIV. I mean, many people now, as I was saying before when we challenged PrEP, many people now are able to take PrEP and are completely unaware that there was even a fight that we needed to be able to get that on. So it serves as a really good opportunity for us to raise awareness, raise funds so that we can continue to do the excellent work that we're doing.
What do you think needs to happen to reach the goal to end HIV transmissions by 2030? And what barriers do you think still exist, and how can you resolve them?
We're at a time of where our medication, whether that be treatment or whether that be prevention, means that eliminating new cases of HIV is already within our grasp. It's already within our hands to actually be able to achieve that. What is very challenging, however, is that there are a number of structural or system barriers that can prevent everybody that needs either that treatment and or that prevention medication from being able to access it. So we need to work collaboratively across the system with community groups, with politicians, with clinicians to be able to put those things in place where we can really kind of achieve that. Very clearly, we need funding and we need commitment. We've got that commitment from government and the commitment from the community to be able to achieve that. And if we achieve 2030, we'll be the first country in the world to do that. So, it's really a very exciting time for us because we can achieve that. We can absolutely achieve it.
Robbie Curry, CEO of the National AIDS Trust. It's been great talking to you. Thank you.
Thank you.